Welcome to the Selecting Treatment Options for Patients Who Require More Intensive Therapy, featuring Dr. Robert Kushner, Professor of Medicine at Northwestern University Feinberg School of Medicine. He is assisted by Gail DeLuca, nurse practitioner at the Northwestern Medicine Center for Lifestyle Medicine. Dr. Kushner will examine hypothetical cases of patients with obesity and develop treatment plans that are tailored to meet their specific needs by focusing on psychosocial and intensified therapy based on medical risks. While these hypothetical patients may have other diseases or comorbidities, the focus of these case studies is on obesity management.
Gail, tell me about the patient.
Well, I have a 40-year-old male here who's here with complaints of recent weight gain. He now presents with a BMI of 35.2. He noticed this weight gain since he became partnered and moved in with his partner about 5 years ago, and his weight just steadily kind of went up. From a food point of view, he's having a lot of difficulty because he works in a very fast-paced environment that offers him lunch every day and also has bins of snack food around the office, so it's kind of difficult for him to stay away from that. He has easy access to sweets at home, and besides that, he struggled with his weight for most of his adult life.
So is he adopting his partner's habits? Is that what we're seeing here?
Well, I think they're cohabitating with those. They both enjoy cooking, they both enjoy eating, and they look at dinners together as the highlight of their day. They're food lovers.
Yeah. Did you ask the patient the role of the partner in the patient's weight? For example, is the partner an ally, a saboteur? Is he indifferent? Is he a supporter?
You know, that's a really good question. I didn't ask that.
Okay.
But I did ask if the partner was gaining weight also, and he was. But I don't know what
about
the
whether
dynamic
so we're
is.
going to want to, when we talk to the patient, we're going to ask about that because that dynamic's being so important.
Exactly.
Okay.
Yeah.
Any other medical problems going on with the patient?
Medically, no. He has a family history of cardiovascular disease. He's a non-smoker. He does have a sedentary job, though. He has a lot of screen time at work, at home, enjoys video games. That's his leisure. He walks to the train, but that's about, but let me back up there. He does have a gym at his work, and he tries to work out daily, but, you know, it's off and on.
Just doesn't happen. Okay, so how would you summarize the patient?
Well, for him, I'm looking at him. He's had weight gain. I think that there's a social component to his weight gain because it's happened since he and his partner have moved in together. He has a BMI of 35.2. He has a family history of cardiovascular disease, and I think that to reduce future weight-related comorbidities, you know, we should address his weight with maybe starting with 5%.
Okay, so that's a good goal. Any other goals that we want to cover when we go see him?
I'm not thinking.
Yeah, well, social is, I think, the key thing, right?
Sure.
So I agree with everything you're saying, but I think what I'm hearing is a lot of social interaction, environmental cueing between being at home with his partner, being at work with the snack bin. So dietary counseling for sure, but we're going to talk a lot about the influence that he's having at home and in the workplace. I think that's going to be key in this patient based on what you're telling me.
Sure.
Good. Let's go see him.
Okay.
Dylan represents so many of the patients that we see, and that is the influence of food throughout the environment, both in the workplace and the home place. One of the most important things we can do is ask Dylan to track his diet for increased awareness and insight. You may even ask him to start tracking the food mood diary, and that is, what is it that's triggering his diet? It also provides accountability if you ask him to track his diet. What you're trying to get at is, what is the pattern of eating and his food intake as it relates to the triggers? Since Dylan is surrounded by food, he has to gain a sense of self-awareness regarding why he's eating, when he's eating, and what he's eating. We call this the ABCs of behavior: antecedents, behaviors, and consequences. He has to understand the cues that's causing him to eat so he can then turn around, with our help, to give him the environmental support he needs to gain increased control. Physical activity is always important in weight management, but in his case, I'm going to focus more on his diet side of the energy intake equation. That's where the calories are coming from. That's where he's struggling. The increased food at work and the increased food availability in his home. I would potentially consider bringing up the topic of a health psychologist as a referral on this visit. He may indeed have stress-induced eating that needs to be explored. Plus, he may need help verbalizing his needs with his partner, since so much of the eating goes on at home and that mutual enjoyment. He also may need a little bit more support. So I would ask him regarding his interest. Dylan has a body mass index over 30, and he may be a candidate for consideration of anti-obesity medication. We would consider a drug that may suppress appetite or may reduce fat absorption. Gail, tell me about the next patient.
Well, this patient is a 40-year-old female who presents for weight loss. Her BMI today is 34, and she really asked that she wants her husband to be more supportive and more interested in her weight loss efforts. She has, medically, there's a few areas of concern, of course her weight, but she also has prediabetes, her last A1C was 6, and she has osteoarthritis. So she has some pain there. She's tried commercial programs in the past. She just didn't feel that they were sustainable. She's always thinking about food, always craving food. Even if she's eating her meal, she's thinking about what she's going to be making for the next meal. Mm-hmm. And she was good during college, but after college, when she started her work life, that's when she noted that she had the most weight gain. Mm-hmm. And she's been able to take off weight in her life, but she's not able to sustain the weight loss. Mm-hmm.
It's interesting you said one of her chief concerns is she wants more support from her husband. Mm-hmm. Tell me a little bit more about her.
Well, as she started to talk about her weight, she became tearful. She was very upset about that. She feels very self-critical about herself. She has a poor body image. She feels like it's all her. She feels like she lacks willpower, that she's not a good person, that she eats emotionally, and that when she gets down, she turns to high-carb, high-fat foods, and she tries to soothe herself with foods. And even while she's eating it, she knows that it's going against her weight loss goals.
Mm-hmm. That's a good pickup. So I guess that's a combination of her volunteering that information and you probing further. So how would you summarize her medically?
Well, I think that she has obesity. Her BMI is 34. I think the obesity is causing problems medically, so she has weight-related comorbidities of prediabetes, arthritic pain, but I think the weight is also affecting her in an emotional sense.
Mm-hmm. So what are our goals going to be when we go in and see her?
Well, I think that the goals should be to address her weight, address her lifestyle, talk about consistency in lifestyle behaviors, goal to start with maybe a 5% weight reduction, mm-hmm. but also because she has a sedentary job and no formal activity program, to start incorporating activity into her life.
You know, Gail, in addition to that, I'm also going to recommend we bring up potentially some psychological support. I was impressed when you told me about her being self-conscious and self-critical. And those are deep-seated issues that need help. I think it's going to be beyond what you and I could probably accomplish ourselves. So I want to broach the topic of her potentially seeing a health psychologist, and let's see what she says and how she feels about that.
That's a great idea.
As kind of foundational mm-hmm. concepts of long-term weight management.
Sure.
Good. Let's go see her.
Okay.
It is going to be important to talk about healthy eating and being physically active. That's important for any patient who's struggling with their weight. It's foundational when it comes to weight loss. However, what Nicole brings out very clearly is the need to resolve some of the emotional issues that she's having. I would actually think about using a food mood diary for increased reflection and understanding about what's triggering her eating as well as change in mood. By doing a good patient intake, you're able to find out what needs a patient has. In this case, Nicole has a great deal of self-criticism and emotional concerns regarding her relationship with her husband and eating. She needs to verbalize those needs and come to a resolution, and I would refer her to a health psychologist on the first visit. It would help her cope better and overcome a lot of these barriers. Nicole's body mass index is over 30, which makes her a candidate for use of anti-obesity medication. I would consider this modality for Nicole. She expressed increased thoughts of food and increased hunger. So I would be thinking of one of the drugs that suppresses appetite as the best option for her. This is, of course, in addition to the social and emotional support that she needs. This was our last case. I hope you have a good understanding of the range of obesity treatment options available to healthcare professionals after reviewing these cases. Remember, a treatment plan is not accomplished in one visit. Obesity is a chronic disease and patients require ongoing evaluation and follow-up. In addition, you do not have to have all of the answers, but you should be able to provide resources and refer out to ensure the patient focuses on the desired treatment goals.